Good evening, everyone, and welcome to the Supplements, Herbs, and Oils webinar brought to you by the Arthritis Foundation. My name is Julie Eiler, and I am both a patient and a staff person with the Arthritis Foundation. I have been living with juvenile idiopathic arthritis for nearly 2 decades now, and I like to translate that experience into some of the work that I get to do overseeing our patient engagement strategies here at the Arthritis Foundation. One of the things that I love the most when it comes to leveraging the power of patient stories is figuring out ways to turn patient stories into data that can drive change. And one of the ways that we collect data at the Arthritis Foundation is in our post-webinar event surveys. This topic, supplements, herbs, oils, is brought to you by your request. This is one of our most frequently requested pieces of content that comes out of those post-event surveys. And so we are really, really excited to bring you this incredibly interesting topic that responds directly to your wants and wishes, and encourage you to, of course, continue to complete those surveys because we are listening and programming accordingly. This evening's guest expert will discuss the evidence behind using certain supplements, herbs, and oils to help manage your arthritis pain and other symptoms, as well as how to get started. Like I said before, events like this are informed and driven by patients like you. And one of the ways that we collect input at the Arthritis Foundation is through a special study called our Live Yes Insights program. With your input, the Arthritis Foundation can create more educational tools and resources and programs that speak to what's really important to you and help you live your best life. That's why I'd like to share a short video with you to introduce you to this study and learn how you can make your voice heard to help us create more programs and webinars and podcasts like this one.
By taking part in the Live Yes Insights assessment, you help change lives today, including your own. And you help change the future of arthritis. It takes just 10 minutes or less to share your experience and make a difference. Answer simple questions like how often you felt arthritis pain in the last week. Ongoing insights data from people like you will lead to new resources that ease daily life. Your insights show what kind of support you need in your community. You improve the healthcare system. You focus researchers and others on top priorities. You'll make more research funding possible, leading to new groundbreaking treatments. The power is in your hands to change things now and for the future. This is your opportunity to change the future of arthritis.
So of course, with that, we invite you to participate in our Insights study. That study is specifically for patients who are over 18 years old, but if your child is under 18 and living with juvenile arthritis or a pediatric rheumatic disease, we strongly encourage you to take part in our JA Insights program, which is directly built for families like yours. Now, before we begin, I'd like to share a few announcements and notes about tonight's event. Unfortunately, one of our speakers, Dr. Amy Pearson, could not join us tonight. So instead, our guest expert, Dr. Alane Costanzo, is going to present her slides. We are so thankful for her expertise in popping in and helping us really deliver all that we were promising in our initial run of show. Some additional housekeeping notes. We have muted all attendees for this event, but you can direct any questions that you may have throughout the webinar into our Q&A box at the bottom of your screen. Additionally, we'll reserve time to answer your questions at the end of the presentation. So we'll try to get to everybody's questions that we can, but we've been able to collect a good number of questions ahead of the event from our patient partners, and we hope to answer all of the most relevant ones to your experience. After tonight's session, you'll receive an email about your experience tonight. And these surveys really do help us to track the success of these sessions, as well as to plan for future events. So if you have a topic idea or something that sparks your interest, please plug it into our survey. Please share your thoughts and feedback with us. We really are listening. Let's get started. So our first speaker today, our key speaker today, is Dr. Alane Costanzo. She is an anesthesiologist, with an expertise in fitness and nutrition. She practices multidisciplinary pain management and is a physician contractor and assistant professor of anesthesiology and pain medicine at the Naval Medical Center, San Diego. Dr. Costanzo completed her pain fellowship at the Harvard Medical School affiliated Beth Israel Deaconess Medical Center, where she was a Longwood Fellow. She is a certified Level 2 Eccentrics instructor, as well as a certified MetaFit instructor. Dr. Costanzo, welcome, and thank you so much for joining us tonight.
Well, it's my pleasure to be here with the Arthritis Foundation and everyone who's joined us this evening. I appreciate the opportunity to speak with all of you today. In getting started, it's important to go through some disclosures that while I am a physician, I am not your physician. I have no financial disclosures, and what I'm going to present to you this evening is a presentation that's to be used for general health information only. This will not substitute medical advice, diagnosis, or treatment for any health condition or problem. Any questions that are in regard to your own health should be addressed by your own physician or healthcare provider. Unfortunately, I can't make any warranties that are expressed or implied representations whatsoever regarding the accuracy, completeness, timeliness, comparative, or controversial nature of what I am going to talk about tonight. I also cannot provide those warranties regarding the usefulness of this information contained or referenced in the presentation. Health-related information changes frequently, as we all know. We've had so many changes over this past year. Therefore, information contained in this presentation, to be fair, may be outdated in a little bit of time. It may be incomplete or incorrect as things change. Statements made about products that have not been evaluated by the Food and Drug Administration will not apply to this, as they do not look at supplements and essential oils. So participating and or watching this presentation does not create an expressed or implied physician-patient relationship. And let's move on to our next slide, where we can get into talking about why we're all here tonight. So supplements for pain, they're very exciting. It's such a fascinating topic to talk about. I had an opportunity to speak about this in November at one of our national pain conferences, and it's just a lot of fun. There's so much interest in this, and I think that's why all of you are here. There's a supplement for almost every medication that's out there, and for those of you who are interested in taking something that's non-pharmaceutical, you're able to do your own research and see what is available. So we'll discuss some supplements that can help you with pain, but not all of them, because there are so many. And then we'll also discuss how to choose a supplement. And this is really important because not all supplements are created equal. And if you do have the time and the interest afterward to go into your a health food store or any store that sells supplements and take a look at the labels, you'll be fascinated. I mean, hopefully as much as I've been fascinated by them, and be able to make a good choice about which one to purchase. We'll move on to the next slide. So the first one we're going to talk about is 5-hydroxytryptophan. And 5-hydroxytryptophan is a precursor to serotonin. And you may be familiar with the name tryptophan because of Thanksgiving and turkey. We all tend to get into a little bit of a food coma, if you will, when it comes to having this. So it's a naturally occurring supplement. It comes from the graphonia seed. And like I said, it's involved in the biosynthesis of serotonin. It's a precursor to it, and it can help with fibromyalgia type pain. It can help with depression. I'll go so far as to say it can help with musculoskeletal pain and types of arthritis. Again, it is a precursor to serotonin synthesis. So what are some things that we need to think about because of this? So it can have adverse effects, and we'll talk about adverse effects for all of these supplements. Well, with regard to GI effects, it can cause GI distress, including nausea. As far as things that can go on with our central nervous system, it can cause headaches, insomnia, dizziness, and palpitations. And It can even cause a syndrome known as eosinophilia myalgia syndrome. Now, this was out many, many years ago, and then actually, and interestingly enough, coincided with the release of a certain antidepressant medication. With that being said, they did think that the supplement was contaminated with something that caused this side effect. It was taken off of the market as a result, but since that has happened, it's back on and you can buy this in stores. Let's go on to our next slide. It can interact with other drugs, and this is important to know, and especially because it is a precursor to serotonin. So if you are taking an antidepressant that is meant to boost your serotonin, you need to be careful because it can cause what's known as a serotonin syndrome, where you have this excess of serotonin in your body, where you may have mood changes, irritation, confusion, diarrhea, dilated pupils, fever, and maybe even an abnormal heartbeat. Can also interact with monoamine oxidase inhibitors, and that's what MAOI stands for. And MAOIs are an older type of antidepressant, so they also will increase your serotonin level and therefore increase your risk of getting the serotonin syndrome. Tramadol, which is an opiate, also has some SSRI and SNRI effects, which can lead to that serotonin syndrome as well. We can move on to our next slide. Another supplement is arnica. In this slide, I will discuss using it topically, but there are other ways to use arnica. So it grows wild in the mountains of Europe and Russia, and some species can actually be found here in the United States, in the Western United States to be exact. It can be used topically. There's a gel form, there's also a cream form, and there's even some pills that you can take under your tongue for it. And it can decrease inflammation and that's related to bruising, sprains, and wounds. It decreases IL-6, and IL-6 can be very pro-inflammatory. It's part of our immune system and part of what leads us to make inflammation in our bodies. And let's move on to our next slide. So, thank you. So some adverse effects with arnica include skin irritation. So because you apply it topically or can apply it topically, you can get a rash or some contact dermatitis. As far as central nervous system effects, if you do take too much of it, it can cause nervousness, restlessness, coma, and death. Cardiovascularly, there can be some side effects, including cardiac arrest at its worst case, some cardiotoxicity and high blood pressure. GI effects would include having abdominal pain, diarrhea, vomiting, anorexia, so not eating, or even some liver failure. It may even cause bleeding, weakness, and dyspnea. Interactions would be an interaction with an antihypertensive because it may decrease that antihypertensive effect if arnica is taken internally, so with those pills. So very easy to get there. Some of you may have even used that, but it is something that that can be very, very helpful. And we can go on to our next slide. So boswellia, frankincense. For people who are familiar with the church, and this was one of the gifts that was given to Jesus, and as we can read in the Bible, and it can be used for pain. It's such an interesting supplement. It's a tree or a shrub. It's found in India, America, North Africa, and Arab countries. Boswellia has been used traditionally for arthritis and other inflammatory conditions. It decreases leukotriene synthesis that's responsible for maintaining inflammation and edema, otherwise known as swelling. It inhibits 5-lipoxygenase, which is something that can cause a tremendous amount of swelling. It's also involved in nitric oxide and what's known as cyclic GMP, ATP, sensitive potassium channel activations, and opioid receptor binding. And that's what helps lead us to the pain relieving properties of this supplement. So we'll go on to our next slide, and some adverse effects for boswellia include nausea, reflux, acid reflux, diarrhea. You can get a rash if it's applied to your skin directly, and can even cause some drug interactions when it's used with anti-inflammatory medications, anticoagulants, and antiplatelets. And that's because it is involved in the clotting cascade as well, related to some of those pathways that I just talked about. there is data on this, and there is data on a lot of these things. So PubMed is something that we use in medicine. It's a specific website that all of you have access to. And this is one specific study that you're looking on the right side of the screen here. And this specific study looked at a lot of different supplements, and boswellia was one of them. And it showed that it can make clinically important effects on pain reduction in the short term. There were some others that had pain relieving properties in the moderate term, but boswellia looked at it. I'll be honest with you, boswellia is a little near and dear to my heart. When I first started practicing after fellowship, one of my patients in the first practice where I was, this was something that she was using, and she had a tremendous amount of knee pain. And she said, "Doc, I've got to tell you, this stuff works." And she brought in this magazine, if you will. It was a catalog, and it had all of these different supplements that you can choose from. She said, "This is the one. This one, it's just helped me so much." So she helped to spark my interest in looking at supplements, but a lot of them have come along the way. But that's my little story on boswellia as an aside. We can move on to the next topic, or the next supplement. So vitamin C, we should all be familiar with vitamin C. It comes from citrus fruits. We know our oranges are a good source of it. Our lemons, our grapefruit. It also comes from, also found in tomatoes and potatoes, red and green peppers, kiwi fruit, broccoli, strawberries, Brussels sprouts, and cantaloupe. It can help tremendously with musculoskeletal pain. Also with what we call CRPS, which is complex regional pain syndrome, and can also be very helpful in herpes zoster pain. So what's its mechanism? It's an antioxidant, and it works indirectly via a cofactor for the synthesis of calcitonin. And I'm going to move some information over here. But what's interesting about the vitamin C is that we can have inflammation that occurs from a variety of reasons. And with that being said, the calcitonin that we think that this works on, it's been used for a long time in the treatment of osteoporosis and other diseases that involve bone turnover. It's also, calcitonin, interestingly enough, has a direct analgesic effect on bone pain, and has been utilized for improving the pain of acute vertebral fractures. If someone has cancer and has bony metastasis, it's helpful for that. And like I said earlier, the complex regional pain syndrome. And what's also interesting is that it hasn't been explored completely, but there's a role of vitamin C in the synthesis of opioid peptides. Let's move on to our next slide. So what are some adverse effects of vitamin C? Kidney stones is a big one. If you do take too much, you can develop kidney stones. You can end up getting low back pain in addition from the kidney stones themselves. Nausea, vomiting, some acid reflux, migraine headaches can occur, and hemolysis, so you can have some blood disorders. What are some interactions you should be mindful of? Aluminum, chemotherapy agents may interfere with vitamin C, estrogen, protease inhibitors, and warfarin, which is a blood thinner. So there is some evidence about taking vitamin C as an adjunct for reducing opioid consumption. In this case, it was morphine consumption, and high-level evidence to support supplementing a gram a day for 50 days in patients who may be at risk for complex regional pain syndrome after they have extremity surgery. We'll go on to our next slide. Cinnamon. Cinnamon is great. It's not just for baking, right? We can put it into our drinks, and it's a pain reliever. So two types of cinnamon. One is the Ceylon, and the other is the cassia. So the Ceylon cinnamon is grown primarily in Sri Lanka, and it's known as the quote unquote true cinnamon. The cassia cinnamon is grown in Southeastern Asia, and it's the most common type of cinnamon that we'll find here in North America. Why do we use it? It can be used as an antispasmodic, so it can help to relax our muscles if they do become spastic or not relaxed. It can be used as an anti-flatulent, interestingly enough, an anti-diarrheal, antimicrobial, and anti-helminthic. It can also be helpful in rheumatoid arthritis. As far as the way it works, they think that it's one of the chemical components in it called cinnamaldehyde, which inhibits nitric oxide production, and that's implicated in inflammatory disease processes. And also it demonstrates inhibition of cyclooxygenase 2 catalyzed prostaglandin E2 biosynthesis. What does all of that mean? Those are important cofactors that are within our own body's inflammatory cascade. Let's go on to the next slide. So with cinnamon, just like any of the other supplements, there are risks of side effects. So oral lesions have been shown to be associated with the use of oral cinnamon products like herbal toothpaste and chewing gum. There may be some occupational allergies reported with the use of cinnamon due to the exposure of its compound. And folks who use them for vaginal suppositories that contain cinnamon oil, they did result in an allergic contact dermatitis in some of them. Patients may also experience a generalized systemic dermatitis, so something that's all over their skin after consuming herbal tea that contains a large amount of cinnamon. And in addition to that, a systematic review of adverse effects reported that GI disorders, so abdominal disorders and allergic reactions were most frequent after consuming cinnamon, but they were self-limiting, meaning they resolved on their own. What's neat about systematic reviews is that when we do a systematic review, we take a look at a lot of articles, and then we pull from those articles and look at their data and then make conclusions based on them. So systematic reviews look at large amounts of studies, and they may pull out just one specific thing from them. And in this case, it was something about cinnamon. Let's move on to our next slide now. Vitamin D, this is absolutely one of my favorite supplements. And it's interesting, practicing pain medicine right now is I do check a lot of my patients' vitamin D levels. It's really important to help them reduce their pain. We find that it can help with mental health in addition to that. So in terms of vitamin D, what's one of the biggest origins? Sunlight, absolutely, 100% sunlight. Keep in mind that you won't be able to absorb those rays of sunshine if you have a lot of sunscreen on. Only you know and may need to discuss with your own healthcare provider, how much sunlight is okay for you to have without sunscreen. Mushrooms are a fabulous source of vitamin D. Fishes such as salmon, tuna, and mackerel are also good sources. Beef, liver, egg yolks, fortified cereals, and fortified milk can also be a really good source of vitamin D. What's vitamin D important for? So many things. Vitamin D, it's involved in so many metabolic processes. It has hormonal implications. It's just incredible. We don't know as much as we will know about vitamin D, but I would say of all of the things that I present tonight, vitamin D is probably the easiest one for you to figure out whether or not you're deficient in it by getting a blood test, and then one that you can supplement easily with to get that number up if it's not high enough. So what do we use it for? Muscle function and strength, as well as coordination, improved pain, as well with regard to fibromyalgia, but any musculoskeletal or arthritic type pain would also benefit from having this. And again, like I had mentioned, there are mental health benefits from having a vitamin D level that's within a normal range. So I can't talk enough about how important it is. As far as the mechanism of it with regard to pain, it inhibits the synthesis of prostaglandin E2, which is involved in inflammation, and it can induce some antimicrobial peptides. There's been some talk, and I don't want to get into too much of it, but because it does that, there's been a lot of talk about what's its role in COVID and what we've all been facing here. We'll go on to our next slide. As far as adverse effects, metabolic effects can include hypercalcemia, so having a calcium level that's too high, GI effects, including nausea, vomiting. It can cause some muscle weakness if you were to take too much of it. As far as renal side effects or kidney side effects, it can cause you to urinate a lot, also known as polyuria, having a lot of calcium in your urine, which is also known as hypercalciuria, excessive thirst, and kidney stones. If you do have too much of it, as well, it can cause arrhythmias. It can interact if you're taking a statin, so a medication that you may take to reduce your cholesterol. It can also interact with steroid medication and thiazide diuretics. There's a lot of data out there on vitamin D, but even with all of that data, we still have a way to go with what we will know about vitamin D. The PubMed has quite a bit. And let's move on to our next slide. So feverfew, very pretty perennial that's found throughout the world, You can find it in Europe, in Asia, North America, and South America. It can be used for arthritis, inflammation, and migraine headache prevention. It decreases platelet aggregation and inhibits the production of prostaglandins and thromboxane. It also prevents the release of serotonin from platelets. So whenever you see something that decreases platelet aggregation, we think about bleeding, because platelets are so involved in our ability to bleed. So when we look at adverse effects, we won't be surprised when we see that there could be effects on that. And in addition, because it prevents the release of serotonin, that we may have some effects with other serotonin-related medications. So let's move on to our next slide. So adverse effects: dizziness, mouth ulcers if you're chewing the leaves of the plant. It can cause some nausea, some vomiting, anorexia, abdominal pain, hypersensitivity reactions on our skin, so we may have a rash, and contact dermatitis. It can cause some muscle stiffness and muscle and joint pain. So with any of these supplements, it's important to take your own individual picture into context and certainly get some advice on which way to go with them. Because as you can see with here, the one thing that we're trying to alleviate is arthritis pain or joint pain. But if something is taken in excess or too much of it, it can have the effect where we get that muscle and joint pain that we're looking to get the relief from. So interactions, anticoagulants, antiplatelets, and NSAIDs. It may increase the anticoagulant properties of these medications because of its effect on the platelets. It makes a lot of sense. Iron supplements, it may decrease the absorption of iron. So you want to separate taking the feverfew from your iron in about 2 hours. We can move on to our next slide. I hope that I'm going at a good pace for all of you. I know that we can't all see each other on this particular presentation, but I hope that this is a good speed. So let's get into gamma linolenic acid, GLA. So this comes from the evening primrose plant that's native to North America, and it was introduced into Europe in the 17th century. And Native Americans would consume the leaves, the roots, and the seed pods of this particular plant. Those flowers are beautiful, and they would consume them as food or prepared extract. Thank you for the feedback on that. So they would use them as a painkiller as well, and also as an asthma treatment. And some of these early therapeutic effects were thought to be because of the GLA that's in the evening primrose plant. And it's found in high qualities in the oil that's extracted from it. It can be used in rheumatoid arthritis and systemic sclerosis. As far as it goes, you can find it in evening primrose oil, just like we've talked about, but borage seed oil and black currant seed oil as well. So what's its mechanism? What's interesting is that all of our cells have a component. So the outer layer of our cells is made up of fatty acids. So by having another fatty acid, if you will, or an oil, it can influence receptors, enzymes, ion channels, and signal transduction pathways. It can also influence numerous inflammatory and immunological processes. So we'll go on to our next slide. So it appears safe when you take it in oral doses of almost 3 grams per day, 2.8 grams per day or less for up to a year. It may interact with herbs that have blood thinning constituents or affect platelet aggregation to theoretically increase the risk of bleeding. If it's taken with other anticoagulants or antiplatelet drugs, it might increase the risk of bleeding or bruising. We can go on to our next slide. Ginger. This is a really nice supplement. It has a wonderful fragrance. We can find it easily in our store. You can even make your own tea out of it, cook with it, also buy it in a capsule form and take it just as a supplement. So ginger is a tropical plant, has greenish, purplish flowers, and its aromatic root has been used for centuries in folk medicine to relieve pain and ease nausea. Ginger ale used to contain the real thing, the actual ginger, and would help with an upset stomach or nausea. The spice is also commonly used in Asian and Caribbean cuisine. Can use it for arthritis and joint pain. It has great anti-inflammatory and antispasmodic and antioxidant properties. So gingerly, The components of ginger can inhibit the production of prostaglandins. Again, these mediators that make that inflammation in our body possibly more effectively than an arthritis drug known as indomethacin. Indomethacin we use a lot to treat gout. And for those of you who may have experienced it or have had a family member who's had gout, may be familiar with indomethacin. And we'll go on to our next slide. It's generally recognized as safe in the United States. It's usually well tolerated when used in typical doses. And theoretically, it may increase the risk of bleeding or interfere with diabetic, cardiac, or therapy for heart conditions and acid inhibiting drugs. Again, it seems that we're having this theme with a lot of the supplements where there can be a bleeding risk. So it's very important that you talk with your own healthcare providers if you're taking anticoagulants or any medication specifically to thin your blood as to whether or not these supplements are safe for you, and if so, in what doses. And we can go on to our next slide. Magnesium, another one of my favorites. It's processed mainly from seawater and by the direct reduction of its compounds. What's interesting about magnesium is we have one place in Utah, actually Salt Lake City, where we can mine the magnesium salt and make it. There's other places in the world, but in the US, we have one place. We use it in acute postoperative pain, chronic neuropathic pain, and migraine headache prevention. It's a cofactor to ATP production. It aids in ion transportation. It competitively antagonizes calcium release and inhibits catecholamine release. It antagonizes certain receptors within our body and NMDA. And magnesium we can use to help relax smooth muscle. So people who have muscle spasms, in addition to what I talked about before, magnesium can be really helpful. You may have heard of Epsom salts or taking an Epsom salt bath, but Epsom salts are magnesium salts, and you take a bath in those, and that can help to relax your muscles as well. We can go on to our next slide. What are some adverse effects? So there may be some GI adverse effects, including diarrhea, nausea, vomiting. There may be even some arrhythmias and hypotension from a cardiovascular perspective, and you may even get some muscle weakness. So like I said, it can really help to relax smooth muscle, and if it is taken in excess doses, can cause muscle weakness. It can interact with some antibiotics, including fluoroquinolones and tetracycline, and also interact with bisphosphonates and thyroid medication, including levothyroxine. There was a study that was done looking at patients who had knee pain radiographically seen on x-rays, and what their magnesium intake was and how that was associated with it. And what they found is patients who had low magnesium intake did have higher degrees of knee pain. And we can go on to our next slide. Rose hips, very beautiful. So rose hips are the round part of the rose flower just below the petals where the seeds are contained. Fresh rose hips contain large amounts of vitamin C, and we've already talked about vitamin C being one of our supplements to help reduce pain. So like I said, the fresh rose hips contain a large amount. The dried rose hips and rose seeds do not contain as much vitamin C. Osteoarthritis and rheumatoid arthritis are great places for their usefulness. The mechanism of action we talked about before, that it is an antioxidant. It's an important nutrient that maintains our neurotransmitter productivity, so how our nerves send out their impulses along a pathway. It helps to maintain, and vitamin C does this, the integrity of our blood vessels, our bones, and our skin. Let's move on to our next slide. Some adverse effects include nausea, upset stomach, constipation, and heartburn. And due to their vitamin C content, excess rose hips may harm those with recurring kidney stones, sickle cell anemia, and hemochromatosis, where you have a lot of iron overloading in your body. There is data for the use of rose hips for inflammatory pain and arthritis. So something else to think about, that there is data out there for the use of rose hips. And we can move on to our next slide. So SAMe, so S-adenosylmethionine, it's found in all living cells. It's a precursor in some amino acids. We can use it in fibromyalgia, for migraine headaches and also in osteoarthritis. It plays an important role in normal cell function and survival. It's needed for adequate functioning of our central nervous system. And it's considered also to be an antioxidant like vitamin C, as well as an antidepressant. So it increases serotonin and dopamine levels. So we can already think, if it's considered to be the antidepressant, what kind of medications would it interact with? Let's go on to our next slide. So adverse effects can include headache, dizziness, insomnia, and sweating, can also cause nausea, vomiting, anorexia, so lack of appetite, and diarrhea. Drug interactions of no surprise, based on it having those antidepressant properties or bumping up our serotonin. The combination of the SAMe with any antidepressants can lead to that serotonin syndrome. And again, that syndrome is where you have excess serotonin and you can get those mood-related changes, the irritation, the confusion, diarrhea, dilated pupils, fever, abnormal heartbeats, and the MAOIs, which are those older antidepressants. It may lead to, if you're taking an MAOI, which is the monoamine oxidase inhibitor, those older antidepressants can lead to a hypertensive crisis when they're used together. So they don't recommend that you use them with the MAOIs. Turmeric. Turmeric is another spice that we use in our cooking or can use in our cooking. It's found in the Far East and tropical regions. It's traditionally used in both Chinese and Ayurvedic medicine to treat inflammation. Its most active compound is curcumin, which inhibits numerous inflammatory mediators such as NF-kappa B, prostaglandin E2, leukotrienes, and nitric oxide. It's got a multi-targeted approach there. And we can go on to our next slide. Adverse effects include nausea, vomiting, anorexia, GI ulceration, hypersensitivity reactions, and it can interact with any blood thinning medications, again, because it works along those pathways that not only reduce inflammation, but also are involved in our clotting cascade. The use of turmeric with anticoagulants, antiplatelets, and NSAIDs may result in an increased risk of bleeding, so avoid using them simultaneously, and then also may interfere with immunosuppressants such as cyclosporine. So and let's go on to our next one, willow bark. So willow bark may come from the branches of 2 to 3-year-old willow trees. And the willow trees and shrubs, they grow all over the world except for Australia and Antarctica. They can provide relief from pain, from fever and inflammation without stomach upset that chemical aspirin can cause. Can also be helpful to treat gout, osteoarthritis, and back pain. What is its mechanism? Well, it's nature's aspirin. The active ingredient that's in the willow bark is salicin, and the accompanying flavonoids and plant particles might be a part of what makes willow bark effective. But the salicin in the willow bark converts to salicylic acid, and that's what is the active ingredient in aspirin. So some believe this makes it gentler on your stomach than lab-created aspirin. We can go on to our next slide. So adverse effects. So they appear to be mild. However, people who are allergic or sensitive to salicylates should not use willow bark. So people who are sensitive or allergic to aspirin should not at all use willow bark. And moving on to our next slide, fish oil. So this is an oil from cold water fish, such as mackerel, salmon, herring, tuna, halibut, and cod. They're very rich sources of omega-3 fatty acids, as well as EPA and DHA, which are other types of fatty acids. Your body can't make these, so you need to get them from fatty fish or from supplements. They can reduce inflammation and morning stiffness. They are used to treat rheumatoid arthritis, lupus, psoriasis, depression, and Raynaud's phenomenon. They're important for brain function and may inhibit the development of rheumatoid arthritis. Omega-3 fatty acids may block many sources of inflammation, including prostaglandins. We've talked about those a lot this evening. They're pro-inflammatory cytokines, as well as inflammation-causing leukotrienes. They're also converted by the body into powerful anti-inflammatory chemicals. We can go on to our next. So glucosamine and chondroitin, two other supplements to talk about. They're natural compounds that are found in healthy cartilage. Most studies are mixed and generally only find benefit for osteoarthritis. In 2019, in the osteoarthritis treatment guidelines, the Arthritis Foundation and the American College of Rheumatology give a conditional recommendation of chondroitin sulfate for hand osteoarthritis. As far as the glucosamine, there's two forms of that. There's the glucosamine sulfate and the glucosamine hydrochloride. They may work. You could try them for a few months, and if there's no relief, then stop taking them. We'll go on to our next slide. So special considerations. This is really important and near and dear to my heart because you need to do your research about supplements and vitamins. So we'll go to the next slide here, but do your research about synthetic versus natural forms of vitamins. It's interesting, when you start learning about them, you'll see that there's a few different types of vitamin E or even vitamin B12. There's a synthetic form and a natural form, and it's pretty easy to look for those specific types, but the natural form, you're going to absorb it much better than you will for the synthetic form. So for example, there's cyanocobalamin and methylcobalamin for the vitamin B12, and you can get them in a shop, but the methylcobalamin is the natural form. You'll be able to absorb that much better overall. So if you are getting vitamin B12 shots, maybe you ask your doctor, what are you giving me? Or if you're taking a B12 supplement, you may want to look at it and say, okay, is this the natural form or the synthetic form? And you can do your own research as well, to look and say, hey, is this specific type of it the natural or synthetic form? And you may look at it on the side of a bottle and it says that it's B12 cyanocobalamin, B12 methylcobalamin. Same thing for vitamin E. There's the D-L alpha tocopherol and then the D alpha tocopherol. Well, the D is the natural form. So you can look on your vitamin bottles and see, what are these? In addition to that, we want to look and see if there's any potentially harmful or unnecessary ingredients in the product. And that's going to come up in the next line on this slide. You want to look for, and we can move to the next line on it as well, look for any soy, any corn, wheat, or other additives. You may even want to just look at if it's contained in an oil. What kind of oil is it? Is it an extra virgin olive oil? Is it an organic oil? Is it corn oil? Is it soybean oil? What is it? Soy can cause a lot of inflammatory conditions. The corn can do the same thing. And we know that wheat is inflammatory in and of itself. So look and see what else are in these supplements. It's not enough just to say, what, I'm low on vitamin D. I need to go out and buy a vitamin D3 and then buy one that contains something in it that will increase the risk or the chance of you having inflammation, just what you're trying to decrease having. So be very mindful of looking at additives in your vitamins. There should be very few. I mean, there are some things that need to bind together to hold the vitamin or supplement in place, but be so mindful. Read all of your labels on your vitamins and supplements and your food for that matter. And then looking in the next line on this side, look at the way it's manufactured. What is the manufacturing processes? Is it monitored and is it tested for quality? In a way to do this, do they follow what's called GMP? And we can go to the next two lines on this slide. GMP stands for good manufacturing processes, and you want to look for this. I look for it on my vitamins. Do they follow GMP, the good manufacturing processes? Do they follow the standard set of the way that they are manufacturing their vitamins? And are they third-party tested to make sure what they're saying is in that vitamin is actually in that vitamin? And there are some fabulous brands associated with supplements and vitamins, and then some other brands that may not put the quality that's in there. And it's up to you to do your due diligence and just have the knowledge of that they're not all created equal and make your decision on there. So you may want to also look for what's called the USP verified to see if they're tested for purity. The other thing that you want to look at, and this may be more on some of the supplements, but even your over-the-counter anti-inflammatory type medications, but do they contain artificial colors? Do they contain MSG? You'll be surprised that some medications and contain MSG? Do they have talc? Do they have extra sugars in them? If you're a diabetic and there's maltodextrin and everything, which is a type of sugar, are you getting that sugar in another form and not even realizing it? So I behoove all of you, and it's in your best interest to take a look and see what's not only in these vitamins and supplements, but any medication that you're taking. And we can move on to our next slide. And we can even go one more on this. Yeah, so I have no financial disclosures, as was seen in the beginning of the presentation. This is a website that I've found that does rank vitamins called Labdoor, labdoor.com. And again, I have no financial interest as of now. It seems like it's a very legitimate website to look at, to compare your supplements and see where they would fall in their ranking structure of how good they are. And they'll grade them A, B, C, and even with an A+, A-, B+, B- type format. And that may help to guide you if you're having some trouble looking at the back of the vitamin bottle to see whether or not this one is a good vitamin. Again, this website may change and might not be such a good resource, but as of now, for me, it's been helpful in looking at supplements and being able to find one that would be a good choice. So with that, it would conclude the end of the vitamins and supplements for pain talk. Is there a best time to take supplements, supplement and medication interactions? How do we manage upset stomach and nausea? It's really important to talk to your doctor first. What we talked about tonight, they're also different. A lot of them have similarities, but I hope that it gives you an overview to some, certainly not all of the ones that you can use for pain.
Dr. Costanzo, thank you so much for that presentation. It was incredibly detailed and helpful so that we could think about all of the pieces of supplements here. We definitely have some questions from our audience to get a little bit deeper, and we're going to take some time to open up the floor to some of those questions now. For our audience, please keep in mind that we've received many questions before and during the webinar, and we'll do our best to address everybody's questions, but we will ask the most common ones first. We've also received quite a few questions about CBD oil and supplements for sleep. For more in-depth coverage on these topics, I want to encourage our audience to view our past webinars. We had one on medical cannabis, and our past webinars, on medical cannabis and sleep and fatigue strategies for arthritis at arthritis.org/webinars. You can also find more information about CBD, including a link to our guidance at arthritis.org/CBD. For specific sleep aid videos, go to arthritis.org/melatonin and arthritis.org/sleep aids. We've also received some questions about insurance coverage and assistance with covering the costs of supplements and integrative therapies. Because supplements are not FDA regulated, there is limited clinical data on safety and efficacy. And as a result, insurers are not required to cover costs. The AF does not have a policy recommendation at this time about the use of supplements, but our advocacy team is working on building a proposal to support the development of evidence for non-FDA approved products such as supplements, herbs, and essential oils. So please stay tuned. And if this is a topic that's important to you, which because you're here, I imagine it would be, please sign up. Consider becoming an advocate with our foundation. I apologize for the sirens that are running past my street. I live in Washington, D.C., and I often have some background noise. At this point, Dr. Costanzo will take some questions about supplements first, and answer any that come in about essential oils later after our second set of slides. If any of your questions about essential oils do go unanswered, we'll post a short Q&A video next week along with this recording on our past webinars hub, which you can find at arthritis.org/webinars. So Dr. Costanzo, let's get started with some questions. The first one that came in is, what are the top 3 supplements that you would recommend that patients consider starting with for the treatment of their arthritis?
A good question. So top three, I probably said that as one of them during the presentation was vitamin D. Vitamin D is it's so important for so many things. And I'd encourage you to check to see whether or not your vitamin D level is low. It's surprising living here in Southern California that the majority, I would say more than 80% of the patients that I test are deficient in vitamin D. It's very, very interesting. And we are in a very sunny area of the United States. With that being said, I again recommend that you get tested for it to see where your level is at, and then use that as one of the others. The other ones I would leave up to the specific condition. If it is something that I'm talking with the Arthritis Foundation today, so I'm thinking that the anti-inflammatory aspects, the osteoarthritis, rheumatoid arthritis would be the ones that you're after. Turmeric and boswellia are good ones to take. What's interesting, the difference between the two, I mean, they're both very great at being anti-inflammatories. The boswellia is a little bit more protective on the stomach than the turmeric. So if you think about anti-inflammatories, especially ones that are prescribed, the boswellia I would ascribe to being more similar to something like the celecoxib medication, which has a little bit more GI protective effect than some of the other anti-inflammatories out there. So if you are looking for one specifically for that, I would go toward that. Then if you're looking for something to treat pain and then potentially, any depression that could be going along with it, you might want to look towards some of the supplements that can also boost up the serotonin, especially if you're not taking an antidepressant. So something like the 5-hydroxytryptophan, would come to mind as a good one to look into.
That's really helpful. I think you hit on the ones that stood out to me, as I know that I've talked with them about, or I know I've talked with my mom about those couple of vitamins, or I know I've talked with my doctor about those couple. So it's helpful, and it reinforces for me some of the key messaging. But I do know it can be hard for patients, especially as they're starting with something like this, to figure out the ideal dosage for the supplements that they might take. How should patients navigate that? Is there a recommended dosage that everybody should start at? Is it specific to the person? Can you give us some thoughts on that?
Yeah, I would say it's specific to the person, and we can use vitamin D as an example. So, if you go to the store and you're looking at a vitamin D3 supplement because you're vitamin D deficient, you can buy a 1,000 international unit, 2,000, 5,000, 10,000. It's just going to be dependent on how deficient you are. If you're not deficient, you may want to even consider taking it anyway. The data is conflicted. I'll tell you, even when you talk about the American College of Rheumatology and their recommendations for vitamin D supplementation, they look at a range from 40 to 60, but there are some folks that say you actually need to be higher than a level of 60 and bump it up there to be really protective. So it depends on where your reference range is. And again, I would encourage you to work with your own healthcare provider. And with that being said, there are some, I mean, we're not all the same, as you probably know, but there are some providers out there who may not be comfortable dealing with supplements or with vitamins. And so if that's the case, it would be okay for you to seek out someone who is. So if there is a naturopath, or there is someone who deals with functional medicine or something else, that you just have another practitioner who's on your team and looking out for you and can give you good guidance on this. But don't hesitate to look elsewhere for somebody who's qualified. And not that means that your provider is bad or there's anything wrong with them. There are just some that don't have the education on this.
That's really helpful. And so often when we're talking with patients about exploring a new therapy option or finding a different kind of mechanism to manage their pain, a lot of it comes back to, how do I start that conversation with my doctor? So if you haven't had that conversation, you haven't explored supplements with your provider, how would you start, or how would you recommend a patient starts talking with their provider about this area?
It's a great question. You can go into to feel them out and see how they are. So essentially say, I've been learning more, reading more. I watched this webinar with the Arthritis Foundation where they were talking about vitamins and supplements. And it seems like vitamin D or turmeric or boswellia could be an option for me. what do you think about me starting something like this, so that you can get a perspective from them as to whether or not they're comfortable with guiding you on it. They may say, hey, yeah, that's a great idea. You're taking X, Y, and Z. Maybe we should back off of that if you're going to try this. Or they may say, you know what, I don't have a lot of experience with that and I'm not comfortable giving you advice. Or they may say that they don't work. I mean, I would just be open to having any of these responses given to you. And again, it doesn't mean that your provider is bad one way or another. It may just mean that they don't have this information. And if that's the case, it is okay for you to seek out someone who knows and who is comfortable talking with you about it. But I would just, the initial question, just like, how do you feel about me trying something like this, would be the best way to start.
Definitely. And I always like to remind people that whether your provider is on board or maybe has some hesitation or needs some additional context, it is important to have that conversation with them anyway, so that you have a level of transparency and they can help navigate if there is a drug interaction or something going on with your other arthritis medications. So with that in mind, can you talk a little bit about, for patients, especially those with an autoimmune form of arthritis, if they are on a disease-modifying drug or therapy, how should they consider spacing their supplements to maximize the positive and minimize any negative potential interactions with their therapies?
That's a good question. And so in that case, too, it would also depend on what the supplement is. Mm-hmm. So, is it one that will directly interfere with it, where they do need to be spaced out time-wise? Is it something that would affect the efficacy of the medication itself, or is it something that could enhance that? In terms of the vitamins, I would be a little bit less leery about putting them in together. And I'm not a rheumatologist by specialty, as we all know. So I'm not as comfortable to tell you exactly the interaction, but just in terms of being a physician and knowing that we need certain vitamins like vitamin D and vitamin C for our own body functions, and then even the fish oil for our own membrane function that can help with that. I think that it is okay to make sure that those things are in good amounts. And then in terms of the other ones, just to make sure that there is no interaction with the specific DMARD therapy that they're getting.
Perfect. That's really helpful. And again, the best thing to do is be your best advocate, talk with your provider, and you can ask your rheumatologist those questions to get additional clarity.
100%.
So what about using supplements prophylactically? Can we use them to prevent pain symptoms, prevent inflammation? How do we feel about that?
Sure. I do think that there are some that you can use in a preventive fashion or prophylactically. Vitamin D, absolutely, 100%. If you're vitamin D deficient, you're not going to feel good. So getting yourself, tanked up appropriately with that is a good idea. Same thing with vitamin C. Vitamin C is very important at maintaining our bone health, our blood vessel strength, and whatnot. So ensuring that we have enough vitamin C intake, as well as, even fish oil, and not super therapeutic. So doses that are above what's needed, but having a good amount, the appropriate amount of fish oil in our body can be really helpful to prevent and prophylactically treat pain.
That's lovely. That's really perfect. And I will sing the praises of vitamin D. My mom is vitamin D deficient, and she lives in Florida, of all places. And so she is always in the sun, and yet she still needs to take a vitamin D supplement. But when she can get those levels up, her whole life, her mental health, her physical health, everything does take on a rosier outlook.
One other thing I'd like to add on that is, especially when you talk about preventive and prophylactically, I am an anesthesiologist by training, so people go into the OR and have surgery. If you are, planning to have a surgery done, or even if, God forbid, you needed one urgently or emergently, having adequate levels of these will help your healing process go a long way toward the better than not.
That's a great point. You can invest in your future a little bit in that way by just making sure you have enough to heal and you have enough to do what you need to do on that biologically. So is there such a thing as taking, in the spirit of trying to fill up your tank, can you overfill your tank? Can you take too many supplements or too much of a particular one?
So you can take too much of one, you can take too many, so you do need to be mindful of what it is and be strategic about, why am I taking this? Is there a specific reason for it? And if you are going to take vitamin D, for example, knowing what your level is and going toward the goal of improving that level, number one. But if you do have too much vitamin D, there is a syndrome called hypervitaminosis D, where you can have too much of it. We saw even with the vitamin C, you can get kidney stones if you take too much of it. So yes, there can be too much of a good thing.
Too much of a good thing. That's a good way to put it. And when you're considering, patients that are starting to add supplements into their regimen, is there a time frame for how long they should take something before they should expect to see a benefit or before they expect to see a difference?
Yeah, and again, it would depend on what it is. So something like the turmeric or boswellia, you may feel that right away. You may feel the effects of those anti-inflammatory type things. The willow bark, for example, the one that acts like aspirin, you may feel the effects of that immediately. Vitamin D, if you're taking it to increase your vitamin D level, it will take time. It will take, it could take up to 3 months for you to get to a level that is appropriate with the supplementation that you're taking. So again, it depends on which one it is, but to give you an idea, I hope that's helped.
No, that's great. I think remembering that each of these is specific and each patient is specific and is going to have a different experience in either way. I think that's a great framing. So now for a specific question about eye inflammation or oral fungus. Is there a particular supplement that might help with either eye inflammation or oral fungus that comes to mind?
Oh, that's a good question. So eye inflammation, I believe that any of them would be helpful. Why is their eye inflamed? Is it something that is superficial? So the sclera or the white tissues that's there, is it the iris? Is it something that's deeper within the eye? It would depend on what the actual cause from it. If it's more superficial, there may be something topical to put on it. There are some even eye drops that have some homeopathic ingredients to them. The systemic ingredients may help with the things that are a little bit deeper, so like a turmeric or boswellia. And then in terms of fungus, what's interesting is that some of these supplements do have the antimicrobial properties. So one that we'll talk about, in fact, I didn't talk about it here, but we'll talk about it when it comes to essential oils, but tea tree oil for oral fungus, maybe one that you want to even consider putting, swishing it around in your mouth, of course, diluted and with some water. But in terms of a specific supplement just for that, I don't have a specific one just for oral fungus.
No, that's helpful. I think it might be a perfect segue into our next set of slides on essential oils so we can learn more about tea tree oil and even diluting things and what that might look like.
like I said, I'm sad Dr. Pearson couldn't be with us this evening because she is an expert on essential oils. And so I was able to hear her talk. We were on a panel together this past fall, and she talked about what aromatherapy is not. And it's not these candles that you'll buy with artificial scents in them. It's not these sprays that you'll have around your home or the soaps and lotions that have these artificial scents put in them. And as you can see, there's another diffuser there down on the bottom right. So going into the next slide for this, an essential oil is, it's a distillate from an aromatic plant. And we can go into the other lines that go along with the slide, but it can come from flowers, leaves, berries, bark, wood, roots, seeds, or the peel of plants. They're highly volatile, and that's important to keep in mind. They're chemical components that come from the same species of a plant and can vary according to the climate, the distillation process, and the plant chemotype. And in addition to them being highly volatile, they're highly concentrated. I'll go to our next slide. So how are these essential oils obtained? So there's two methods of extraction with essential oils. And they can be done either with the steam distillation, cold pressed. But with that, so steam distillation is probably the most popular method to extract essential oils. And during this process, you have botanicals that are placed into a still, and then you have this pressurized steam that's forced through the plant material. And if you can imagine using a steaming basket on your stove, the hot steam forces open the pockets on the aromatic compounds within the botanicals, and then the compounds escape the plant material and evaporate into the steam. And the steam must not be hot enough so that you can allow the release of the essential oils while not damaging the plant material. So it's a little fine balance you have to meet with the two. And the steam with the essential oil then passes through a cooling system. And that's further along in this. I don't know if you can see my mouse if I move along here. Can you see my mouse? You can move through here, but on that long bar that runs through it, that's the cooling system where the steam condenses into a liquid consisting of the essential oil and water. So, oh great, you can see it. So you've got water that's coming out and then water that's going in, and this is that whole cooling process that's here. And then some of that water goes down with the essential oil, it gets trapped in here. Some of the water will get vented out to the sink, but the oil is lighter than the water, so it's going to float to the top, and then they can separate the oil from the water. Very good. So as far as, so that would be the most common way to get the oil out. So we'll go on to our next slide. No chemicals are used, and this is an example of what one actually looks like when you do go to steam distill the oils. So how are essential oils used? We'll see this in our next slide. They can be used in an inhaled fashion and also in a topical fashion. If we inhale them, they can be nebulized, they can be diffused through a diffuser. And we can discuss a little bit more about the carrier oils, and then as well as direct inhalation. As far as topically, they can also be diluted in a carrier. They can be used in compresses and as well as gargles, which we just talked about in our next slide. So how do you tell if your essential oil is real? Look at the label. So look at all of these things in here. So the oil must be pure, unadulterated, and you can see at the very top of the bottle on this and the label, it says pure essential oil. And then underneath it's what is the common name, and this one is holy basil. Holy basil is one of my favorites, by the way. It's an adaptogenic herb. It can help a lot with stress and really protect our adrenal function. The Latin name you'll find underneath of it, the genus, the species, and the chemotype. And then under that, you'll see what the country of origin is. And then you'll see how it was grown. Was it wild? Was it organic or conventionally farmed? And then below that, you'll see the method of extraction. Was it steam distilled or was it cold pressed? And then the part of the plant that it was taken from. So that's one important thing to look at when you're choosing an essential oil. So going into the next slide, why are they so important? When we inhale them or smell them, smell is really important. It's our most primitive sense. It's the only sense to bypass the thalamus, part of our brain. And it's closely linked to the limbic system. And that limbic system is tied to memory. And I don't want to speak for all of you. I'm thinking that a lot of you can smell a certain smell and that will remind you of a certain place that you've been or a person that you know. Our olfactory sense is extremely powerful. We'll go on to our next slide. So what are some safety tips regarding essential oils? So always dilute them. So use anywhere from 1 to 10% of the actual essential oil with a carrier oil. So have it in a 1 to 10% ratio. Never use them internally. So, if, like we talked about with the mouthwash, is it something that you would swish around in your mouth and then spit out? Any essential oil can be dangerous if it's used incorrectly. Keep that in mind. Wash your hands before you use them. Wash your hands after you use them. If eye contact occurs, make sure you rinse with milk or a carrier oil to help dilute it and take it out. Some oils are photosensitizers, so I'll just talk about being out in the sun. Be careful if you have an oil on you because it can make you more sensitive to that sunshine. Some oils should not be used with children and pregnant women. Essential oils can exacerbate reactive airway diseases. So if someone has asthma or some other type of reactive airway disease, they can exacerbate them. So be careful using them around folks who have those medical issues. Do not self-diagnose. Aromatherapy is not a substitute for medical care. So in terms of, before we get into the lavender, so how do you dilute them? You can get them either where they're already diluted. If you have an aromatherapist or plan to find one, they can dilute them for you. A lot of them do come already mixed, but they should always be used in what's called a carrier oil. And that creates a base and dilutes the essential oil to a level that's effective, but won't irritate your skin. And most carrier oils have benefits in and of themselves, including softening, healing, etc. So they can support the benefits of using the essential oil. So lavender is one of them. Most of us are familiar with lavender. It can be used to help treat anxiety, skin healing, acne, insect bites, insomnia, asthma, flu, pain, burns. Its chemistry is that it contains esters and alcohols. There's no skin irritation that's been seen at a 16% dilution. It may increase drowsiness that's caused by some drugs just because of that effect of it causing or treating some insomnia. People use lavender a lot at night. It has some evidence that it can be used to treat psoriasis by targeting cytokines or those inflammatory markers that are increased in psoriasis. Going on to peppermint, it can be used to treat indigestion, IBS, nausea, headaches, colds, coughs, and muscular pain. It contains alcohols, ketones, and esters. It can be a stimulant and be sensitized, so you may want to avoid using it in the evening. It might be something that you would prefer to have in the morning to get you going. Avoid it in cardiac patients or those who have G6PD deficiency. And it can interfere with some of the enzymes that break down the medications that we take, and even the uptake of some cancer medications. So going on to our next slide. Tea tree, which we had talked about a little bit, can be used for acne, athlete's foot, Candida albicans, which we just referred to again with the fungal mouth infections, as well as MRSA infections. It contains terpene alcohols and esters. No irritation with tea tree oil at 10%. Do not take it internally. Do not swallow it. It's a natural anti-inflammatory and antimicrobial. It can decrease some surface bacteria and fungus as well as viruses, and theoretically presumed to help with psoriasis because of its anti-inflammatory properties. Bergamot. For those of you who like Earl Grey tea, this is that citrusy scent that we get in our Earl Grey tea. It can be used to treat insomnia, depression, and anxiety. And it contains terpenes, esters, furanocoumarins, and bergaptan. And bergaptan can damage the skin, cause some photosensitivity, so be really careful in putting this on and going out into the sun. It can be used for inhalation or on non-exposed skin. This is also a natural anti-inflammatory and antimicrobial. It can help decrease skin surface bacteria, fungi, and viruses. It's theoretically presumed to help with psoriasis because of its anti-inflammatory properties. We'll go on to our next one. So carrot seed oil is interesting, right? Promotes healing, stimulates the healthy regrowth of damaged skin and tissue. Carrots, we know, are very high in vitamin A, and vitamin A is really important for our skin function. It also has antiseptic qualities. East Indian sandalwood oil is shown in clinical studies to decrease inflammation and thickness and psoriasis plaques of the skin. Again, always dilute these in a carrier oil and avoid citrus when treating patients with, or when treating yourself for psoriasis. And tips for getting started. I'll leave this this next slide for answers from the nurse practitioner, or where you may get some of your other questions answered regarding essential oils. But I hope that this was helpful for all of you in Dr. Pearson's absence.
Oh my goodness, Dr. Costanzo, the fact that you tagged in for Dr. Pearson just 24 hours before the presentation, that was remarkable. I would have thought you were coming in to do this specifically for essential oils. So thank you so much. We do have a couple of questions from our audience that I hope we can get to, and then we can close out our conversation for the night. But let's start off with this one. Can oil and water-based supplements be taken at the same time? Is there anything we need to be considerate of there?
You may want to space them apart, and again, more so dependent on the types of supplements they are. But you may want to, you may want to space them out by at least 2 hours before taking them, while taking them during the day.
Perfect. Quick and easy answer. We love it. Can an entire supplement regimen be taken at one time during the day if it is all consistent, or should it be spaced out? And what does that look like?
So again, it would be in accordance with what you're using the supplement for. So say that you have really bad arthritis pain in the morning, that may be when you want to take your turmeric or boswellia to help you with, because you're feeling it. Conversely, if you're feeling those symptoms at night, that may be when you want to take them. Those sorts of things would be based on when your symptoms occur, and I would use that as your guideline. In terms of other times to take them, you also need to look at other medications that you're taking. So if there is an interaction with something else that you're taking, that's a prescription or potentially even another supplement, that you do need to space them out. So again, it depends on the patient, depends on the circumstances that they're in.
Perfect. And considering patient-dependent supplement guides and kind of guidance, what is the thought around juvenile arthritis and supplements? How do you feel about supplements and this kind of evidence being applied to children?
Yeah, so young children, I would veer more toward the vitamins than the supplements. So, the vitamin D, making sure that their vitamin D levels are adequate. We give vitamin D to babies, all the time when they're born, just to make sure that they get that supplementation. Same thing with vitamin C, that we do give those vitamins to them. In terms of supplements, again, they have to just look at their whole medical picture. Do they have any bleeding disorders? Do they have any gastric disorders or what have you? But I would look carefully at each patient, especially if they do have the juvenile arthritis and what else could be bothering them.
Perfect. And then for maybe some of our adult patients, is there a particular supplement that would be great for osteoarthritis, a different one that might be great for rheumatoid arthritis, and maybe a different one that might be great for something like fibromyalgia? Could you give us a quick fire recommendation for any of those disease types?
Sure. So fibromyalgia patients, I would have one that has more of the effect on the serotonin. So having something like the 5-hydroxytryptophan would be more ideal. As far as the osteoarthritis, rheumatoid arthritis, I think going with either the turmeric or the boswellia would be a good option. And certainly the willow bark, if you're able to tolerate the aspirin part of it, would be good. I don't know that I would separate the two of them in my recommendation.
That's perfect. And so I think last question of the evening is really about method of bringing these vitamins, these supplements into your life. Is it better to eat certain herbs and add them to your diet, or is it better to take them in a supplemental form? What's the thought process there?
So again, it's getting back to how good is it. So if you can have the ginger root and you've got this fabulous organic ginger and you just want to grate it in your tea and have this nice cup of tea where not only you're getting that aromatherapeutic effect, but getting the benefit of having it, I would say go for that. But if it's just ginger is not your thing, but it helps you with your arthritis, then take the supplement form of it. But again, make sure that it's a good supplement. So I can't emphasize that enough. Whatever it is that you are taking, vitamins, supplement, even your medications to the best that you're able. Certain prescription medications you have zero input on what they are. They just are made the way that they are, but it's good for you to know what's in them. In terms of the other additive effects, so I would just look at the quality of what it is. But if tea is your thing and you prefer to get your supplement through a tea versus a pill versus, you know, the edible form, then that's a personal preference.
Very helpful, and it's good encouragement to really do your research and find the products that are going to be those high quality products that really fit into kind of the lifestyle that you want. If it's tea, it's tea. If it's added into your diet, it's added into your diet. If it's a supplement, it's a supplement. Perfect. Dr. Costanzo, thank you so much for being in the hot seat and answering some of these questions on the spot, and your wonderful presentations. They really were so informative and inspiring for a lot of us who have thought maybe about supplements, but haven't had the language to look up all of the information that you shared with us. So thank you so much. It's been just lovely, lovely conversation. And as we kind of close out tonight, I just want to end with a couple of recommendations and thoughts for our audience members. We want to remind you that we have several resources and events coming up to help you manage your arthritis. In particular, on June 17th, we're going to host our Men in Chronic Pain, Overcoming Stigma and Finding Solutions Facebook Live event. And we're excited to bring a diverse panel of patients and physicians together who will discuss the various physical and emotional effects of managing chronic pain for men. You can register and learn more about future webinars like this one at arthritis.org/webinars. And again, we have some of our past webinars living on that webpage where you can learn more about medical cannabis, as well as sleep and fatigue strategies for arthritis. Which we know we had many questions on for from our audience members today. Additionally, if you're looking for sleep aid specific videos, check out arthritis.org/melatonin and arthritis.org/sleep aids. It is Walk to Cure Arthritis season, and we are so excited to bring you, depending on your city, different events that may be in person or virtual, where we gather together and fundraise to fight for a cure for arthritis. You can visit walktocurearthritis.org to learn more. Also exciting news coming up, our JA camps and conference are going virtual this year. For more information and to register for these incredible events, go to arthritis.org/JA conference and arthritis.org/JA camps. Don't miss out on these important events for families living with arthritis. They are really some of my personal favorites at the Arthritis Foundation. And speaking of personal favorites, I would be remiss not to plug our Live Yes with Arthritis podcast. I get to be one of our co-hosts on the show, and it's just so wonderful to get to interview incredible experts and bring you conversations with about hot topics in arthritis, and where you can learn the latest in disease management and treatment. You can visit arthritis.org/liveyesPodcast to take a listen. Not only that, we've got lots of great tools and resources to help you get the support and resources you need. Our Live Yes Connect groups and online community are your key to online and virtual and in-person someday support in your arthritis experience. Our online community forums can connect you to peers and experts, including our virtual support groups, where you can meet people who understand your experience and can help you accomplish your goals. Learn more about virtual support groups and the online community at liveyes.arthritis.org. And if you have a question that's specific that you can't find an answer to on our website, or you just need some personalized solutions to an arthritis issue, you can contact our helpline. Please see the number and the URL on the screen. And finally, as I said at the front of our conversation, you know that I love data. It's one of my favorite things. And so please check out our Insights program, our study that allows us to understand patient-reported outcomes related to arthritis and bring you more personalized solutions to your community to combat some of the trickiest parts of your arthritis experiences. Please take this survey if you are eligible and over 18 with arthritis, or if you're a parent of a child with juvenile arthritis or a pediatric rheumatic disease that is under 18. Check out arthritis.org/insights for more. As a closing reminder, please note, again to our data, in a few days, you should be receiving a survey about your experience at this webinar this evening. And we really do take every result into consideration. So take a look at the survey, please fill it out completely and honestly, and we will do our best to respond and serve you best in the future. Thank you so much for joining us tonight. Please take care of yourselves and let us know your feedback and thoughts in our survey soon. Have a lovely evening. Thank you so much.